Hello and welcome back to another video. Now today I wanted to touch on my sinus surgery and give you kind of an update and where I'm at the moment. So I think I'm about 8 weeks post-operation when filming this. So I am technically at the marker of it should be healed, it should be fine. I think that's like 8 weeks is like how long it should take to actually fully recover, fully heal, all the shebang. Now, I did talk on the procedure itself in another video and how that experience went. So if you want to listen to all that, go to that video on my page. However, today we're just going to talk about, has it worked? You may be wondering, has it worked? Yes and no. Now, yes in the factor of, because he got rid of tissue, I think, in the middle, he made the septum less enlarged. It became more room for my nose to breathe, basically. It gave more airway room for air to go through, which in the factor of itself worked in that aspect, so that works fine. However, the problem what I went in for was inflammation in my forehead. Now, if you've seen anything that I've posted, you'll see that I actually have inflammation here post-operation. But I don't think I got this until at least 7 weeks. If I'm not wrong, 6 weeks, because I started getting the inflammation in my head and I was concerned because I was like, it's literally what I went in for and it's not fixed the problem, because the problem that he kind of thought was that it's so enlarged that the air's not getting through to the sinuses, which is causing the inflammation in the head and all the other issues. But that problem is fixed and the issue is still there. However, it's a lot less mild at the 6 week, 7 week mark. But now that I'm in 8 weeks, yesterday I had like, I don't know if it was like a flare, but my whole head was like headache mode. I had inflammation all of my sinuses, and it felt like prior to my surgery what the inflammation in the top of my head felt like. It hasn't felt that severe since, or prior to the surgery rather, which I thought, yes, it's actually worked in the way that it's made it less mild, but it's still there until yesterday. Because yesterday I had so much inflammation, it felt like you woke up so groggy, kind of like you have a hangover, which can't say I've experienced, but that's how I feel like it would be, like kind of like you've been hit by a train, not a train, a truck, whatever, and you're just like, whoa, like your head is so groggy. That's kind of what it feels like. And then on top of that, you've got your inflammation, your nose is sore. Like I still, to this day, have sore nose from the surgery itself. I don't know if that's because he straightened the nose and the structure or what have you, but whatever he did, I still have nose pain from it. Not like you just get pain out of nowhere. It's more like if you touch it, kind of, you get pain. I don't know. Anyway, since 7 days post-operation, I have been doing the sinus rinses twice a day, morning, night, which is fine, but that doesn't actually solve the issue. It just makes it feel a little bit better, if you will. And so I rang maybe 6 weeks post-op about the inflammation on my head. I said, I've been getting inflammation like this, and I don't like, when can I start using nasal spray, because I know you couldn't use it like after a certain period of the surgery because it's not good. And then some specialists have different instructions for different patients, or I don't know. So I rang the specialist. They said you can't have the nasal spray until at least, I think it was after 7 weeks, or at least 7 weeks post-operation. So I had to wait at least 7 weeks. So I had from December 16th to, I think it was February 4th, 3rd, 4th, is when I kind of had that period of no nasal spray. In saying that, I didn't actually feel like I needed it for the December, most of January. It was just the end, kind of where I kind of felt like my symptoms were coming back to where I needed the nasal spray. So yesterday I have used the nasal spray for the first time since my operation, and I felt like it did help with the inflammation, and it feels like I feel better today because of the nasal spray. And so I have used it this morning as well. So I am going to try continue to use it daily if possible, because I don't want to go back into that flare, if you will call it that. And I don't see the specialist until the 24th of February, which is in another couple weeks. So I can't really hold off without it until then, because I just won't be a functioning human. Did it work? Yes and no. So it worked, but it didn't work, if that makes sense. So it just depends on what you think it's working for. So it worked for the factor of being able to breathe better, but it didn't fix the inflammation in my head, if that makes any sense. It's way less mild, but it is still there. Long story short. Yeah, the reality is I still get fatigue, super fatigue yesterday from the whole thing. I get really groggy, I get facial pain, I get obviously the inflammation in my head. And the weird thing is, to me, is I don't really have mucus in there. Like, I do nasal sprays and barely anything comes out. Like, it's not like a mucus issue where it's just blocking it. It's just inflamed. And I don't know why, because apparently I have chronic sinusitis. I don't know if that's how you pronounce it, but that's what the CT said. He said it was chronic rhinosinusitis, which is basically the same thing. It's just called something different. So basically, chronic inflammation. But I don't know if that's fixed by the surgery or if it just makes it better. The other thing I want to touch on, though, too, is I haven't seen anyone else like having similar experience in the aspect of what I went for. I know people that have had the sinus surgery and they've either come out and it's been worse off, or they've come out and it's been better off. It's really 50-50. Or talk to other people that have had the same physical symptoms prior to the surgery, for the surgery, to then know what other people have had their experiences on the other end and what it may look like for different people. But for my specific symptoms and why I went into it and came out with it is different to other people. So I don't know what the outcome is supposed to look like. I didn't know, well, I still don't know whether I was supposed to come out with it just being a better version of my nose rather than a fixed version of my nose, if that makes sense. And I know it is different for everyone, and I know everyone goes in for their different reasons. I know people go in for, they have had chronic infections in their sinuses and they have to, fix that. And then they're fine afterwards because they've gotten rid of whatever the problem is. But for my case, it's a little bit different because it's inflammation within, I suppose it's within the tissue. I don't know. But anyway, long story short, I am better in the aspect of recovered from the surgery, but it is not fixed and it is not 100%, if that makes sense. So it's still, I think it's still healing in my nose because it is still tender to touch, and I can't wear glasses for a long period of time because it starts hurting my face and it just spirals me. But it is better in the sense of I can function. I could have, well, prior to yesterday, I could have functioned without the nasal spray because it was better in the aspect of getting, I don't know, better in the aspect of how it was functioning. But since yesterday, I'm kind of scared to not take the nasal spray because I'm scared that it will flare my face up and I will be back in the position I was prior. So I don't know, you take this with a grain of salt and you take it how you will. But that's my update, and that's kind of what's happening with my sinuses. I will let you know an update on what the specialist says when I go in there at the end of the month and what he thinks. So we'll find out, but stay tuned for that.